Good evening. This is Dr. John Bennett broadcasting from Miami. Tonight we have the pleasure of having Selene Parekh, foot and ankle surgeon, orthopedic surgeon from Duke University in North Carolina. Tonight, Selene is going to talk about a couple of things, mainly about his interactions with Google Glass. And he's done a bunch of interesting stuff, such as having a telemedicine conference from India, as well as being involved in a few projects of his family over in India with foot and ankle education. So, good evening, Selene.
Hey, John. How are you?
Good. How are you doing?
Good. Thanks for having me.
Welcome. Could you tell just a little bit about your background, where you went to school, training,
Sure.
and with a little bit about how you got oriented, because you're obviously smart in computers, how you got oriented to computers and what you took up, and etc.
Sure. So I actually have a little bit of a unique background. Kind of throughout my life, I've always intentionally or unintentionally, or probably subconsciously, tried to break the mold. So when I was in medical school, 2 years into medical school, I had seen a lot of the hospitals merging and decided I wanted to get my MBA. And so I took time off from medical school, went to business school, then came back to medical school, completed that. And when I started looking for residencies, I really wanted to find a way that I could tie in my MBA to the orthopedic training. And so I was fortunate enough to get a spot at the University of Pennsylvania, where I then took a year off during residency to do a fellowship in healthcare entrepreneurship at Wharton, which was phenomenal because I started to get the understanding of entrepreneurship, product development, and the power of technology. Because after that year, as a resident, I had started a company with a partner of mine that did thought leader management, and a lot of that was based on technology platforms that were on the internet that were just emerging at the time. Well, after training, I came down to the North Carolina area, and now I'm at Duke, where I'm part of the foot and ankle team. But I have an appointment at the business school and at the medical school, so I continue to try to lead a dual life. Sometimes wearing my holding my business briefcase, and the other time my surgical cap. But it's been fantastic, and from my standpoint, in a really solid way, we are now starting to see technology collide with medicine and provide the potential for tremendous solutions for things that we haven't been able to do for a while.
And when did you first run across Google Glass?
So I had heard about Google Glass right prior to the launch. And at the time when Google Glass had announced that they were going to pilot the program, I had gone to the website, saw that it wasn't open to the public, and then saw a little link for individuals who were interested in being explorers. And so I followed that link and found out that you could put in a proposal, and I did that. And for about 8 months, I never heard anything back from Google. And 8 months later, I got an email. I had totally forgotten that I had put in the proposal. And Google came knocking and said, hey, if you're interested in being explored, we'd love to kind of pursue the idea you had. And then my idea was really based on work that I had been doing in India, not here in North Carolina. And so about 6, 7 years ago, my family set up a foundation that does charitable surgeries in India, but we also do training of orthopedic surgeons in India for foot and ankle care. And we were starting to get a tremendous response from the local orthopedic surgeons, but the problem I saw was that although when we were there it was intensive and very, very educational, there was a gap between the times that we would go to India, which was twice a year, sometimes 3 times a year. And so I was looking for a solution where I could be able to easily broadcast my surgeries from the operating room to India, utilizing the difference in time zones so that I could continue the educational process. And so my proposal to Google was all about that idea and that process. So I got the Google Glasses sometime in September, October timeline, And here in North Carolina, I was just playing with it in the operating room casually, just trying to learn the technology, learn the power of it. Every January, our group goes to India. We take a team of orthopedic surgeons for the charitable work. And so this past January, I was in India, and as part of the pre-meeting, we were doing a press conference. Well, it happened to be that at the press conference, I happened to pull out the Google Glass in my hand, and the media went nuts over it. They said, "Wow, you have Google Glass. We need to see that in action." Now, my intention wasn't to be able to broadcast at that time when I pulled the Google Glass out of my hand. I just thought I'd broadcast from the surgical suite into the conference center, and that was it. But now that the media got a hold of it, and there was a frenzy over it, I mean, it was literally like blood was in the water and sharks were feeding. I mean, these guys were crazy about it. And so I said, I assured them that they would be able to see Google Glass in action the next day when I was in the operating room. And so that whole night, the hospital and I were just trying to figure out how could we broadcast live on Google Glass. How could we, I already knew how to do the Google groups, but that doesn't allow me to broadcast to anybody anywhere.
Right.
And so I started quickly doing some research over the internet. The hospital realized that their Wi-Fi wasn't strong enough, so they started calling the Wi-Fi companies and dropping in line that night at 2 in the morning, trying to get me very high-speed internet that was dedicated just to my need.
Right.
Well, morning comes around, we finally get it up and running. I have downloaded some software on the platform on my laptop, which can take my desktop and broadcast it anywhere.
Okay.
And so we broadcast the first total ankle replacement in the history of the world to be broadcasted by Google Glass.
Wow.
It's pretty cool. But the cooler thing was that the press had put this all around the newspapers, all around the news, the evening news, and so we had 15 to 20,000 individuals hit the website, and so the website crashed, unfortunately, because we just couldn't keep up with the capacity. So halfway through the surgery, the website crashed. We got it up and running again for the rest of the surgeries that day, but it made me realize that this was not really a cool little gadget that I could wear in the operating room and play around with, but that there was a real tool and a necessity for this kind of technology in the operating room, where surgeons could not only bring in anybody to the operating room with them, but it's almost to the next level where you can bring in a surgical team where I'll specifically talk about total ankle replacement. It's a pretty uncommon surgery. I'm at one of the leading centers of the world for it, and so we have expertise here. So imagine, somebody around the world is doing a total ankle replacement, runs into difficulty, he has his Google Glass, and at the command of his voice, he calls in a surgeon like myself or one of my partners, and we are there in the operating room with him at the sound of his voice. To me, that was tremendously powerful, and so I think that is one of the things that we will see evolving with Google Glass as we move forward.
Yes, you definitely, the more I've been around you docs that use it, because I'm a doctor too, but I've never used Google Glass. I've never even tried it on. But the general feeling I get from most of the doctors that it's just starting. The things are just starting. And that, especially when I saw, I'm going to have a hangout with the gentleman, a doc from Dignity Health out in San Francisco, that have a program called Augmetics, where doctors use Google Glass for a patient visit. And because initially I was kind of like you, I thought it had a niche in surgery and it would be kind of like neat and fun and stuff like that. But then after I saw that, wow, this Google Glass may possibly be used by all doctors in their office, because the reason why, Selene, I'm sure you can relate to this, is that it cut down on paperwork.
Absolutely.
And we know as doctors, one of the worst parts of the job is sitting at, writing stuff or punching in stuff for long periods of time and not being able to pay attention to the patient, which of course is necessary, but it's a necessary evil. But we think that Google Glass may be cut down on the administrative part of medicine, which would be that's almost like penicillin.
Oh, absolutely. I imagine a future where, kind of like the police officers, all of them now wear little cameras on their uniform. that many of us will wear. It might not be Google Glass, it might be some other wearable technology, but some kind of camera which captures our interaction, and where we may prompt the dictation to happen with a few key words, or maybe the entire patient visit gets recorded, and someone in some other country uses that and really transcribes based on what we are saying that's recorded during our interaction with the patient through Google Glass or some other wearable technology. And we no longer have to sit there and be in front of our EMR spending more time in front of the computer than with the patient. I don't think that's too far off from reality.
No, well, I'll send you the URL when we have the Hangout, but they're going to speak about that because they went on record in saying it cut down between 30 to 40% of the time they spent with doing administrative things, because essentially it's your visit is recorded and videoed so that it goes directly into the EHR, so that you don't have to transcribe it. But of course, there is a I guess a problem with Dragon sometimes with the there's mistakes made.
Right.
95% accuracy. I don't know. Do you have much experience with Dragon at all?
We have in our EMR, there's the competition to Dragon, and it's similar to Dragon, but it is not 100% accurate. So a lot of times you will get gibberish into the dictation.
But yeah, you know what? There was a doctor on, Brian Levine, early in the month. He's an obstetrician from New York. He is a true believer in Dragon. He's used it ever since it came out in medicine, and he said he's good at it. He said, hey, these doctors, they just have to spend some time with it. They have to get to know it. They have to, learn it. And he says, I have no problem. And of course, I've talked to other doctors. Paul Sotek from Indianapolis said that he spends a lot of time going over it and etc. But I think that it'll work eventually, and it just has to be worked on.
Right. No, I agree. I think that's the wave of the future, at least for medicine here in the U.S.
Yeah, that's it's going in. Well, I guess at Duke, is there anyone else using glass, or are you the only person around using glass in medical settings?
Yeah, so as far as I know, I'm the only person who's using glass. One of my colleagues in the orthopedic department has recently contacted me. He recently got his pair, and he is trying to work through the red tape to get it approved. The problem with not only Duke but most health systems, I think, is going to be how do you regulate this technology? I don't think most of them even understand what to do with it, and this is not your old school way of doing things. I mean, this is propelling us into obviously the future, and the problem is a lot of the attorneys that are affiliated with the health systems just don't know what to do with it, and so at least from my experience here at Duke, and then even what I've seen and heard from colleagues around the country, the medical legal guys are getting all over it, and they're really trying to clamp down on it until they figure out how they can regulate it. Fortunately for me, what had happened is that I had already been using intraoperative cameras in my operating room routinely for 3 years. And
Right.
so I had already had the approval for cameras. And so
Right.
when I brought Google Glass in, they said, well, this is just another camera.
Exactly.
And so we just kept using it, which is correct. We just kept using it like I normally was using cameras.
Right.
Well, with all of the media attention that I've been getting with the usage of Google Glass, I guess what has happened is when the medical legal guys at Duke found out about it, they said, okay, well, you seem to be using it in a very HIPAA compliant manner, and that's fine. But for everybody else moving forward, we got to figure out how to make this work properly.
Right. Well, Paul Sotek from Indianapolis, I mentioned before, like he said, it's just like another camera. And as long as you don't have an outside connection, and it's used as a video type of thing, and you don't mention names and the usual HIPAA stuff. That's just, it's just a machine. It's just another machine in the OR. I guess
the only thing is you got to be very, very careful about the HIPAA stuff, because obviously, when I have the intraoperative operating room lights that are hooked up into my the cameras that are hooked up onto my lights, it was only looking at the wound. Obviously, with Google Glass, it looks wherever I look. So if I'm looking at X-rays that are on a light board, or if I'm looking at the patient itself or the anesthesiologist, you got to be very careful. So that's where you're right. As long as you're not on a Wi-Fi connection, you're just archiving, and then you edit that video and do whatever you want with it later on. You're safe. But you've got to be very, very cautious about the HIPAA issues.
Well, that's interesting. You know, it was really interesting what you said about your experience in India. That you know, did you write a story about that? That sounds like a pretty exciting episode of your life.
Well, actually, the New York Times in the science section just about 6 weeks ago did a whole thing about it.
Yeah.
And,
I missed that. I got to look at it, but it sounds like it's exciting.
Yeah, it was amazing. And so I'll be back in India this over Labor Day weekend, and we'll see if I may do that again. You know, when I'm over there, I don't have to. Although I am cautious about the HIPAA laws over there, I don't have to worry so much about broadcasting. I mean, over there, they'll mention patients' names right in the news reports, and so I won't do that. But I don't have to worry necessarily about the broadcasting. So when I'm there during Labor Day, I may try to broadcast again. So if anybody's interested, and John, I'll let you know if we end up broadcasting, so you can let everybody know.
Sure.
But otherwise, next January when I'm there, we will definitely be broadcasting.
Yeah, I look forward to that. It sounds like a real challenge, and I know it's doable. I know with this technology of Hangout technology combined with Google Glass. Now, was Google still allowing Hangouts when you were over there doing that broadcast? Or
So it was January, so it was before the software shut it down.
right?
So I was able to do it, and so you're right. So come Labor Day, unless there's a new update to the software, I won't be able to do it. Although you did have Kyle Samani on from
Austin, from Pristine.
Yeah, from Pristine, and I'm working with that technology to see if there's ways to broadcast, and there are. It's all HIPAA compliant ways, but the problem with that is it's not open access, obviously, because it's HIPAA compliant. So it's not open access for us to be able to broadcast to anybody anywhere. So I'll have to figure out how we can kind of maybe even use that platform.
Well, we'll work it out, and I'm sure we'll be talking at the conference about that. A lot of people will be talking about that issue. It's a pretty important issue. But as a side note, one thing, Selene, in my research for putting together these Google Glass Hangouts, I saw a definite difference in the amount of usage in different countries. Of course, the United States is number one, but number two is Spain. Spain, they have a lot of docs using Google Glass. I was surprised to hear that. Have you had any interaction at all with Spanish docs?
I haven't had any interaction with any of the guys who are using Google Glass, but I've heard a lot about it. There's a surgeon who set up a whole software company built on being able to broadcast through Google Glass, although, again, with the software update, it must be shut down for now. But they are really aggressive about adopting that technology, which is great. There's a couple of Italians that are, some Swiss guys that are. I mean, I think you're seeing pockets of it throughout the world.
Yeah, we had Pedro Guillen, MD. He's one of the first guys that had a pretty large broadcast to 300 clinics or 300 universities, along with the software company you're talking about. It's called Droiders with Julian Beltran. They worked together to broadcast that. And yeah, I think it was it was in September of last year, before Google took the Hangouts off. I think it was done in a Hangout format. But I've run into Dr. Mucilli, various parts. But I went to Rohan, who we talked to, Rohan Kandahal, MD. He's a breast surgeon from Bangalore, and I asked him about it, and he didn't know any Indian doctors. And I'm surprised to hear that story you have. I'm sure it'll be there eventually, because Indian doctors seem to be pretty tech hungry. I know.
Yeah, there's a general surgeon that I know of who's using it, and a plastic surgeon as well. So I do know, and Rohan's not one of those. So obviously, there's at least 3 guys who are casually using it over there.
Yeah. I know the Indian medical community seems to be very active online with medical education. Could you talk a little bit about that? The things you're doing in India with medical education.
Yeah, so my area of expertise in orthopedics is foot and ankle surgery. And if you look at the state of orthopedics in India, they are up to par with global care from hip replacements, knee replacements, sports medicine, trauma, pediatric orthopedics. But when it comes to foot and ankle surgery, they are behind where they really need to be, and a lot of the pathology is being ignored. A lot of the orthopedic surgeons haven't really trained in it because there aren't a lot of guys doing it. In fact, before we started any of our efforts to train, there were only 3 orthopedic surgeons in all of India who were dabbling in adult foot and ankle care. For a population of 1.2 billion, which means over 2 billion feet, that's to me not acceptable. And so a lot of people were being either ignored, mistreated, and that leads to loss of jobs and quality of life and depression and suicides and things like that.
Right.
And so when my wife's a physical therapist, and so when she and I came back from a trip 7 years ago to India, we said, we've got to find a way that we can make a difference and change this. And so we started doing this course. You can actually find out about our foundation in the course at ParekhFamilyFoundation.org.
Okay.
So my last name, familyfoundation.org. And so we started it 5.5 years ago, and since that time we've done about 70 charitable surgeries, trained over 600 orthopedic foot and ankle surgeons. We take, like I said, a team of orthopedic surgeons from the U.S. with us who just spend the entire weekend lecturing on foot and ankle care. That we do hands-on stuff, hands-on training. We show live surgeries that are the charitable surgeries. And since we started our efforts, there are now 7 dedicated foot and ankle centers in India. There are over 30 guys who've said we're going to only dedicate our careers to foot and ankle care in India. And it actually makes me kind of humbled that one of the first people who came to our meeting just published a paper in the #1 foot and ankle journal based on his series of stuff that he's been doing since he's learned some of the foot and ankle stuff that we've been training him in. And so the volume there is tremendous. The thought process is if we can teach the Eskimos how to fish, they can feed the village. And
Right.
that's really what's happening. And it's been tremendous. And it's been very satisfying from our end. The orthopedic surgeons from the U.S. and Europe who come with us, for many of them, it's life-altering because they've never been to India. It's their chance to go see what's going on there. And they are amazed at the advancements there, but then shocked at some of the poverty and some of the lack. It's a duality of the world that you probably have really never seen before. And so I think it's been a win-win for everybody.
Just touching and changing gears a little bit, touching on something you said earlier, as far as doing a complete foot and ankle joint replacement, which is rare, I guess. Could you comment about the place for Google Glass and something like that? Because since you'd be one of the probably the few docs in the country that do that, the potential to broadcast to other orthopedic surgeons that want to know about the procedures and want to watch it.
Well, I think there's, in the operating room, that's really one of the tremendous potentials of Google Glass or again, any wearable eye technology. So you can do some education and training of rare procedures and make it readily accessible to anybody anywhere in the world. And so I'm already speaking to one of the leading total ankle replacement companies here in the U.S. to try to get them engaged to do some of that because it's a very powerful tool. And it doesn't just apply to orthopedics. I mean, you could do it for transplant surgery. You can do it for cholecystectomies. You can do it for anything. And it's just about bringing expertise to anywhere in the world and being able to train. And it's not only training other doctors, but it's also training the reps. So how amazing would it be that the reps who service you as a surgeon in your operating room are able to see what master surgeons of that procedure are doing in the operating room? I think it's fantastic, and I think it elevates the care for patients globally.
Yeah, that I'm speaking to you with the MBA hat on now, as far as training reps for a company that may be interested in doing that. From a business aspect, that seems to make sense to be able to do that with any rep they have, like a huge company like GE or Medtronic or something. That
Yep.
would be an excellent way to train their reps, even out of the OR.
Even out of the order. Oh, I mean, exactly. I mean, so a lot of these companies hold training conferences where they bring in 30, 40 surgeons to learn a different procedure, a specific procedure. But even if those surgeons who are training are wearing Google Glass, and then that content gets broadcasted around the world, I mean, this is very powerful. And again, it's just the tip of the iceberg. And the people who think that this is just a fad, I don't think they really understand the impact and how disruptive this technology really is.
Yes. Yeah. Well, yeah. I'm really excited to be associated with all you guys and to learn about what's going on, because I do feel that it's just beginning, especially when I saw that it applies to most doctors. And I think within, I'd say, 5 years, that most doctors in their, especially busy doctors in their offices, rather than have to run around, because I'm sure you've worked in real busy clinics where a lot of the time spent chasing down blood work and X-rays and that kind of thing. Here's Paul.
Hey, Paul.
Have you met Paul yet, Selene?
No, I haven't, but I've seen you on some of the other Google Hangouts when I've watched some of the archives.
That's the
I
new
like those
set.
glasses, though. I haven't seen those before.
Yeah, those are the new sets of Google Glass just came out.
Oh, nice.
No, John missed him last time, so I figured I'd bring him back. Nice to meet you, Selene. Thanks for doing this. Sorry it took me a little while to get on tonight.
No, that's pretty cool. So they have two cameras on them?
No, actually, it's just lights. I got them from some Chinese website, and then they got a pointer on them, like so you can. Like,
I was gonna say, it makes you look like Bono.
yeah, it is kind of funny. It does actually, but.
Hey, Paul, we're gonna finish up. I'm just gonna finish up.
I actually was like playing around. I saw a whole box of them, but go ahead.
Okay, I'm just gonna finish up. We can chat. Hold on. Okay, thank you very much,
Sorry.
Selene.